Howdy, everyone. My name is Victoria Hamilton, and I'll be discussing graduate nurses' cognitive overload and Benner's middle range theory of novice to expert. As our country's population ages and many experienced nurses retire, the focus shifts to new graduate nurses and their importance as they enter the nursing field. A common concern is clinical judgment and decision making among new nurses. Research has shown that 40% of new graduate nurses fail to recognize a patient's urgent problem and 50% fail to intervene appropriately. Novice nurses often feel overwhelmed by the large amount of and complexity of patient information, making it hard for them to determine what is clinically significant and when to escalate concerns. This can lead to can cause delays or missed communication with providers, potentially leading to adverse patient outcomes. Clinical judgment is essential because novice nurses face the challenge of making critical decisions that can affect patient care and safety. Several factors that contributed to cognitive overload are stated in this diagram. As you can see, there are many things that contribute to this: machines, technologies, environment, workplace, measurements and trainings. Communication, probably one of the most important things, is also vital, along with the people that these new nurses work with, as well as policies and procedures and new methods that they're faced with. When nurses are overwhelmed with too much information, they may struggle to prioritize and focus on critical patient care tasks. This is often when errors are most likely to happen. Patricia Benner's novice to expert theory was chosen because it is relevant. It explores the stages as a novice nurse experiences when they begin to practice. This theory explains how nurses develop their clinical skills and judgment over time through experience. Benner argued that nursing knowledge evolves not only through formal education, but primarily through experience, reflection, and situational learning. As the novice nurse starts out, they lack experience and depend on guidelines. They are learning to identify patterns, situational cues, but cognitive overload can impede this understanding. Benner's theory explains why new nurses often miss warning signs, not because they lack knowledge, but because their cognitive processes involves analyzing situations to understand how they work or why they occur, rather than acting automatically and intuitively. As you can see, like a tree, the new nurse grows and develops. Benner's core concept in the theory describes 5 levels of nursing proficiency based on Dreyfus's model of skills acquisition. These include Level 1, Novice. This new nurse lacks experience and relies on rules and guidelines, shows inflexible performance. Level 2, Advanced Beginner. As a new nurse begins to grow, they begin to recognize patterns and situational cues, but still depend heavily on guidelines and established roles. Level 3, Competent. Able to plan and prioritize, this evolving nurse's decisions are more deliberate and well-informed. Level 4, Proficient. As the nurse begins to grow holistically, seeing situations in this manner, using intuition and experience to guide care, and begins to see the entire picture. Finally, Level 5, the Expert. This nurse comprehends situations and performs smoothly and adaptively. Decisions are automatic and highly intuitive, also known as having a gut feeling. Research shows that using Benner's framework from novice to expert, along with measurable nurse competency scale, can help nurse educators support new nurses by offering insight into the skills and knowledge needed for nursing competency. Nursing knowledge grows through experience and various situations. Clinical competency is situational and improves with experience over time. Experience and reflection are essential for growth, and theory and practice must work together to develop expertise. Several interventions can be implemented to address this issue. Incorporated structured simulation-based training or clinical decision-making frameworks could improve nurses' clinical judgment. Although these are important, one important intervention that is highly recommended are residency programs. These programs allow new nurses to work alongside and learn from more experienced nurses. Those are usually our nurse leaders and nurses that are at a level 4 and 5. These nurses are also known as preceptors. Research has shown that new nurses hesitate to perform new procedures alone. However, with additional support, they feel more confident and integrated into the unit as part of the team. The study also found a positive connection between preceptor support and skills such as organization and prioritizing, communication, leadership, professional satisfaction, and overall job satisfaction. In conclusion, graduate nurses advance through stages as they gain experience. Experience enhances judgment and competency. Expertise depends on content, practice, mentorship, and, of course, strong leadership. The institution becomes essential to support and provide advanced skill levels for the new nurse. It is important to collaborate with new nurses to develop these skills and promote critical thinking. This will allow them to work effectively with patients and feel confident reaching out to providers with key information about their patients, thereby facilitating the next steps in their care. More importantly, this leads to improved patient outcomes.